The policy centers of Roosevelt represent the distinctions between the different issue areas that we work in. Rajiv, Narayan. I'm a senior at the University of California, Davis. With respect to healthcare, I view that as both a goal and a set of issues. The goal in mind is to make sense of the Byzantine sense to which healthcare policy is created. We pass 1,000-page reform bills, and literally nobody in this country can make sense of it, let alone young people or other people affected by healthcare. So part of what I consider my role to be is to make sense of these issues to the public, highlight what works, put a light on what doesn't, and ask people for better solutions. My project idea aims to engage the Farm Bill. This is really tricky because the Farm Bill, so far as it goes through Congress over the past couple of decades, is notorious for how exclusive it is. The only folks who get to influence the development of this legislation, which, by the way, carries as much as $238 billion of funding over several years, are industry executives in agriculture, many times folks in rural states, even though the bill is supposed to impact the entire country. And in fact, while it's called a farm bill, over 70% of its funding goes towards food stamps through the Supplemental Nutrition Assistance Program. So we're looking at this in the Roosevelt Network, and one of the questions that came up is how can we get people into the fold and get them to voice their ideas on how the Farm Bill should be developed? And an idea came out of looking at the Millennium Blueprint. What we'd like to do is we'd like to do our Think 2040 trainings across the country, work with organizations in partnership, find out what young people think their priorities and values are with respect to food and agriculture, and develop a blueprint for a farm bill from young America.